Hi, my name is Megan Cross, and I am going to talk about my personal health education slash health promotion philosophy statement. So just a little background about me. I am a certified registered dental hygienist. I began my training at Hillsborough Community College, where I obtained an associate in science and dental hygiene. I then later completed some more work at St. Petersburg College, where I obtained an Associate's of Arts degree and then a bachelor's in applied science and dental hygiene. And I am currently a student at the University of Florida Health Education Behavior Master's Program. Right now I am a part-time hygienist at a private practice in the Lakeland area, and I am also an adjunct faculty member at Hillsborough Community College in the dental hygiene program. My ultimate goal, and the reason I really went back to get my master's degree, is to teach full-time at a dental hygiene program. A master's degree is required, and I wanted to diversify to focus a little more on public health and education, more so than dental hygiene. So my personal health education slash health promotion philosophy statement is I want to contribute to the dental hygiene workforce by preparing healthcare professionals to engage in public health to improve the oral health of various populations. And my 3 supports of how I'm going to achieve my personal philosophy statement is I'm going to build confidence in clinical skills. And I'm going to build this confidence in my students that I work hands-on with, and through community service projects that I will have my students complete throughout their education at Hillsborough Community College. And I'm also going to have them develop health education programs to help various populations. So, first main point is I will help dental hygiene students build confidence in their clinical skills. For example, I will dedicate hours of hands-on training with my students and my fellow faculty members on proper instrumentation. Just a little background, instrumentation is when we are removing the plaque, the tartar, the calculus, bacteria from the tooth. We use what's called instruments, and the motion is called instrumentation. It is important that students have proper instrumentation training in order to feel confident in seeing patients. So I will achieve this by having intercalibration within faculty. It is really important if we are going to teach the students various skills, we need to teach them all the same way, and we need to make sure it's the correct way. A little research I did found that intra-calibration and intercalibration is needed for all faculty members. So this I would achieve by having days with the faculty where we just have different calibration activities where we are asked to remove like a piece of tartar from one tooth, and make sure we all can do that and watch each other do different skills to make sure we're all doing the same, and how we grade the students is the same. And moving on to how we grade the students, I would use skill evaluations. So this is basically when we ask them to complete a task, if they learn a new instrument, if they learn a new skill, a new x-ray, something like that, that we would assess how they do it and then their final product. And some research I found is that standardized testing, such as skill evals on students, it does create confidence in clinician skills. The students, even though they may be afraid of getting a bad grade, they really just need to know how they are doing. So they need to be graded and assessed correctly, and that is again something that would require calibration within the faculty. I would also ask the students to evaluate the instructors. Typically at the end of the semester, we would have the students evaluate different adjunct faculty. And if we ask the questions correctly, we treat our students properly so that we don't have bias, we should be able to get good results. And these results will be reliable and valid according to some research I did. Second main point is I will require every student to complete community service hours every semester. When I was in dental hygiene school, we only had to complete them 2 semesters that we were there, and we were there for a total of 5 semesters. So for example, I would require every student to engage in community service each semester. And in that semester, I want them to have at least 5 hours that are dedicated specifically to dental community service. I believe it is very important that the students want to be public health servants, and what better way to engage that than have them go into the field. 3 supporting points. I would do mandatory 10 hours of community service every semester with at least 5 hours in dental community service. By having so many hours, they're able to give back to their community, but also, once again, gaining confidence in their skills if they are volunteering in dental community service activities. And the next thing I would require the students to do is I want them to record and reflect on service hours. Yeah, we need to record them for a grade to make sure they're doing it, but it would be a great time to reflect on their hours to see what they learned. And I did some research, and just writing down causes deep thinking and reflection. So having the students write a 1-page paper on what they learned that day, what exactly did they do, how did they feel about it, and asking them their feedback on how they could improve and how that whatever organization they volunteered with could improve, or what they liked or didn't like about it. I would also use community service it increases the students' awareness of population disparities. Some people just really don't know how bad or how unfortunate many people's circumstances are. So by having them do community projects, they become more aware. Study found that community service does create social awareness in students. My last main point is I will require students to create education material to present to various populations. So we have our clinical skills, confident, they've started engaging in community service. Now we need to educate these populations that they're reaching out to. So for example, I would have students create presentations based on different populations and their needs. It is important to be exposed to diversity and educate groups of people based on their needs. Not everybody's the same. Everybody has different oral needs, and sometimes those oral needs are very dependent on your age and your race and your gender. So 3 supporting points of that is teamwork. When they are creating these education materials, I would have them in teams of 3, and they would be assigned 1 age population or 1 race population to create a health education program for. And then they would be able to present to their classmates to educate them, but I would have them all rotate so they go to different sites, but they use other people's materials and they can tweak it as needed. And upon some research, I found that teamwork is something that is definitely always can be improved in healthcare because it is very essential. Another sub point is that they need to select the proper verbiage for various age populations. Obviously, kids, you kind of have to quote unquote like dumb it down for them. They're still learning a lot of words and their vocabulary is small. Whereas older people, they may have a little bit of dementia, so you may also have to make it more simple for them. People all have different preferences for how they want their information presented, and that's something I found in research that we really need to take into consideration. I would also address different oral health needs in various populations. So once again, when they're making their presentation, they're doing research to find what oral health needs that their population that they're focusing on needs. In conclusion, dental hygienists, they are key public health figures that they can really help educate various populations on their oral health needs. Once again, to reiterate, my philosophy statement is I want to train future dental hygienists to be dedicated public health servants through building their clinical skill confidence, exposure to community service, and development of health education programs. And then the next slide is my references. Some more references